The Pain Relief Center has been through a few names before we came up with the name Pain Relief Center. And it's always been on this corner, this location, nestled in between West Hollywood, Beverly Hills, and LA. And it's been very convenient compared to other locations. Street corner, walk-in, in the exact area of the Fairfax district. I've been doing this here since 1987. Graduated from Georgia, started in New York, and I found that Georgia had a better technique of adjusting their program, and I ended up there and graduated there. Then I was either going to go back east, instead came out here, enjoyed the lifestyle and so forth, and had an opportunity, and I moved here and practiced here. So the Pain Relief Center started off with simple, call it simple, but chiropractic. I used the Gonstead diversified technique. Luckily for me, which helped, my dad was a chiropractor also, so it was in the family. Holistic alternative approach, which actually reinvents yourself, and it instructs you to go in another direction besides reaching in the medicine cabinet to treat quite a few of the ailments or discomforts that can happen in our backs and our spine. And again, a lot of it originates from the spine, which protects these nerves and protects the famous immune system that's in our bodies. So chiropractic focuses and specializes in most musculoskeletal conditions for releasing an intelligence, an innate intelligence that's within that spine. And with the proper adjustment, it releases that. So besides the focus on chiropractic adjustments, when I first started, that's all I had in here. Then we decided, as we advanced and moved along, to do a more comprehensive approach to certain conditions that, in all fairness, do need it. So we have massage therapists. We have 7 massage therapists, an incredible team. And so besides the adjustments, then we also prescribe before or after massages, and they do medium to deep, sports medicine, Thai therapists, and they get the job done. And it works great with what I do. In addition to that, we also have acupuncture, which through action, experience, and educating myself, I realize how it also works well with the adjustments. It's anywhere from 15 minutes to an hour session of acupuncture, and we have some amazing acupuncturists here that are well-trained and experienced, as I am in my own profession. IV drips, vitamin injections, Myers cocktail, and glutathione, immunity injection, NAD, which apparently is very popular here in Los Angeles, and I'm getting to see myself how it helps a big deal. Then we also we added in stem cells, their core blood. Seems that they do incredibly well in rehabilitating and bringing back to life a joint, a ligament, and a tendon. The ability to expand and be creative in your approach to treating someone and not being so narrow-minded in one's own profession. So it's called comprehensive healing. So again, it went from a small place to now a big place with different choices of selection of treatments. In addition, for example, for any kind of disc, unfortunately, or break or fracture or other deep chronic ailments, we also have something called PEMF, pulse technology. And it's amazing how successful and patients are responding to it. You need to do at least 5 to 10. Then we also have a matrix machine, which specializes in neuropathy. There are 4 suction cups with sponges, and the session is about 30 minutes to an hour. And again, you do a series of them, very effective. I was on my way to just doing the massages and the adjustments, but now I expanded into all these other services. So it's an adventure, it's fun. It's very successful, I notice, with patients and their recovery and their response. And instead of sending and referring them out elsewhere, I decided to do under one roof. So if you're coming in, depending on your condition, if it's an acute flare-up, and I'm seeing you for the first time, anywhere from 1 to 3 treatments, in all fairness, is necessary. Then it becomes a chronic or maintenance. Maintenance is once a month for an adjustment. That's usually recommended. There are patients that just are under a lot of stress. They want it more often. By all means. You can do that even once a week. depending on your condition, obviously your insurance, and what you can afford. But ideally, monthly is recommended. And again, it depends on the condition. And the type of patients we have are usually musculoskeletal, non-fracture break patients. Then otherwise I refer out to orthopedic referrals that we work with.